I talked about that. A lot of times, even menstruation, the fact that somebody is what? On their menstrual cycle, we don't like to talk about it. We're like, ugh. It's gross. That's one of the things that I want you to be able to be comfortable and say, okay, no, it's not a taboo. Because one, we have these different products on our body, and this is something that can be useful to a developing human individual. So now, women who breastfeed are less likely to develop type 2 diabetes than women who don't breastfeed. Within that, you have all these different factors. Again, this is what you're trying to prevent. It can lead to high blood pressure. It can lead to the hardening of the arteries. It can lead to heart attacks, heart failure, kidney failures. So again, that's what we're always trying to prevent. We're always trying to offer that avenue of saying, okay, these are things. These are the given risk factors. Are people always going to say, yes, I will accept it and I will use it? As I almost knock over the table. No. But one of the big things I'm always trying to use is information. For you, information is going to be the biggest key as you're going along. And then this. This is where I have HIV, but I think I was going to add something else, but I didn't. But initially, we're going to look at this. Because again, you also have to take this into account. The health of the individual again. Because even though we say, yes, they're supposed to be breastfeeding, there is also different risk factors again. So if the individual has HIV, are they supposed to be breastfeeding?
No.
No. Because one, it can be transferred to the baby. So, a woman should not breastfeed if she has an active case of tuberculosis. So if you look here, infection of the lungs, and everything else. So it's one of the big things is we want to make sure that we're also offering that preventative measure. Because a lot of times we get so caught up, and I've met individuals who are very baby friendly, and they kept pushing this without the realization that one, there are other risk factors that some individuals also have. So a woman who's taking a drug that may be transferred to the infant in her breast milk should not breastfeed. So you have an individual, what is that? Let's see. I want to say it's marijuana. Yeah, she rolled a blunt and she's smoking a blunt right now. So I believe that's what it is. Or it might, yes, it is. A joint, there you go. What's the new slang for weed right now? Who knows? Nobody knows. Everyone's like, I don't know. I haven't worked with inmates in a while, so I've lost all the key phrases. But one of the things we come to find is individuals at times are coming from very unique circumstances. That's the reason why as we're talking about it, we're always looking at all these different avenues. But as we look at it, we're also looking at hormonal birth control. So it doesn't get in the way of a woman's what? Breast milk. Therefore, it does not affect the baby. And I've had different discussions with individuals who also look at intimacy. They're saying, you know what, I'm having this baby, but can me and my partner still have sex? And I said, yes. And they're looking like, really? What if she gets pregnant again? Or what if this happens? Or what if and there's all these different avenues, and there's so many different questions that come up. And I'm thinking, well, one, if she's on hormonal birth control, she's fine. She's not going to, again, it's one of those things where there is a small possibility, but overall it's still okay to carry on a person's sex life, so long as it's with the same partner, so long as you're not also carrying on risky sexual behaviors. So SSRIs. So say, for example, you're on some type of antidepressant or a mood stabilizer. Within that, you're also looking at the impact of what can happen. Again, it also can impact the child because what is being intaken can also impact the baby. Again, it can cause lethargy, it can lead to poor feeding and fevers. in an infant that is exposed. So one, you have Prozac. So Prozac seems to have the most negative effects. Zoloft has the least. So again, Prozac, if an individual's on Prozac, that's one of the things you're always taking into consideration. You're taking all these different factors into consideration. Because one, the primary care provider hopefully does an overall screening of the individual. But again, I'm teaching abnormal behavior right now. And one of the things we're always looking at is, it's very subjective. Counseling and all these different aspects are very subjective. So if you come across an individual that says, hey, yeah, you know what, I'm on Prozac, but I'm also breastfeeding, that's where you say, okay, whoa, this is a concern. You're impacting your child. This is impacting the child. So now, breastfeeding, women who find themselves in need of pain control. Because again, it's one of those things where you have headaches, you have all these different things, cramps, all these different factors are coming in, your spouse is suddenly annoying you, all these different aspects. Again, that can happen. So now you're looking at safety. So you have acetaminophen, you have ibuprofen, you have oral codeine, and you have hydrocodone. But if you're taking morphine, and any other method of delivery in regards to codeine, again, one of the big things is it can be and it should be sedated in terms of it should be stopped. Because one, you want to make sure that you're withholding these so that an individual will not be impacted. So the baby will not be impacted. So, PCP. Again, these are aspects that will cross. They will cross into the breast milk. Let's see. So we'll click on code number 1. Okay. So this is an initial outlook. So I'm going to scroll down. All right. So this is where we're looking at that. So again, it can increase the likelihood of stillbirth. But I have a lot of individuals who are from the outlook of, you know what, I smoke weed, it doesn't do anything to my mind. It doesn't do anything to my brain. It doesn't do anything to anybody. And I said, yes, it does. Your brain shrinks. And people are like, what? No, it doesn't. It hinders your short-term memory as well as your long-term memory. But then when you're also taking care of a baby, are those factors also going to take into play? Because if you're taking care of a baby, and you get the munchies, the focus of your baby is no longer going to be there. The child's going to be put off to the side. Oh, you know what, I have other things to do. I have to do this and I have to do that. And one of the things is, it's not so much that the drug will cause you to suddenly lose your whatever. It's the fact of withdrawals. That's the thing that will cause an individual to go, in essence, bonkers. Because when a person is having withdrawals, what's going to happen to the individual? They get shakes, they have to have it, they will use any method possible to get what they need. And now it comes to the area of neglect for who? The baby. So again, this is in your PowerPoints. And then you have cocaine. Yay. Well, I shouldn't say yay. So if you scroll down, let's see. Oh, okay, here it is. Let's see if I can open. Here it is. Okay. Can you guys see that? Should I zoom in a little?
Yes.
Okay, let me pull out this, and nope. What is going on? Let's see. Okay. Alrighty. So I want you to read that small excerpt. Can you guys all read it? Can everybody see it? Okay. I'll just read it out loud. It says, a woman who was breastfeeding her 1-week-old daughter reported using a dab of cocaine on her lower gum in this area and nursing her infant with no effect on infant's behavior or sleep pattern. 1 week later, she used about 500 milligrams of cocaine intranasally. In other words, one in through her nose, boom, over a 4-hour period, and breastfed 5 times during that period. Again, it increases that level of breastfeeding. 3 hours after first ingesting the cocaine, the mother noted that her infant became markedly irritable, had dilated pupils, and began having vomiting and diarrhea. The infant became increasingly irritable and was taken to the emergency room 4 hours later. On examination, the infant was found to be tremulous and irritable with frequent startling after minimal stimulation and to have high-pitched crying, hyperactive reflexes, mood lability, and hypertension. The infant also had signs of fetal alcohol syndrome. So again, what's happening? Again, these are not individuals who are model parents. And we can see that. The infant remained irritable 12 hours after the last cocaine exposure and remained tremulous and easily startled 24 hours after the last exposure. Irritability and tremulousness slowly abated over the subsequent 24 hours. Mild hypertension persisted up to 72 hours after the last cocaine exposure via breast milk. So now we're going to go down. So let me scroll down a little. All right. So now this is the second one. The mother of an 11-day-old, now mind you, this is 11 days old. That's it. It's not a year old, it's not even those. 11 days old, infant applied cocaine powder to her nipples for pain relief. Now that was smart, right? She's thinking, you know what, pain relief. I'm going to use cocaine and I'm going to put it on my nipples and everything else, and the pain is gone. Not realizing that she has a what? Baby. So now she then breastfed her infant using a breast shield that allowed protrusion of her nipples. 3 hours later, she found the infant gasping, choking, and blue. On their arrival at the emergency room, the infant was ashen and cyanotic. Cyanotic, what was that? What was happening to the hands and everything else? Pink, and then what was happening to the outside? Blue. He had hypertension, tachycardia, shallow breathing, hypothermia, was in status epilepticus. Seizures resolved in a few hours after treatment, and the infant was discharged at 16 days of age with no apparent sequelae. Along the infant's cocaine exposure was not via the drug in breast milk. It illustrates the extreme risk of exposure of young infants to cocaine. Again, a lot of these individuals are coming from very unique backgrounds. So again, that's one of the things you're always looking at and saying, okay, what? Wow, where did I go? Wow, where did I go? I scrolled so far. Oh, no, I'm going backwards. Okay, there you go. All right, so then you have heroin, and then you have PCP, and then you have amphetamines. So amphetamines are one of those things where we do prescribe that legally. It is a prescription. Are they okay? Okay. So breastfeeding. So now you have a little baby. I know, it's startling. Within that, alcohol readily passes into breast milk. So individuals who are heavy drinkers, what happens is even for that child, they also begin to take on what? The traits that are happening with the adult as well. So loss of pain sensitivity, deep sleep, inability to suck, and deep respiration. So now you have a child who's So for me, when I had my baby, I love him to pieces. He's now going to be 11. It scares me literally. But one of the things is, as he slept, how many have ever done that with your child? You just literally wake up just to check. That's what I would do. Just to make sure I saw, and I'm like, okay, his, okay. Because again, I teach on this, so I'm always like, Okay. And I kind of go about my every day, and I'm like, all right, it's okay. He's good. I checked. But I'm one of those individuals where I'm like, because literally he is, if you ever become a psychologist or you go into that field, your child becomes your own, that's who you, yeah. Not so much experiment, I don't want to call it experiment, but it's one of those things where you use them as a model, and that's what you try to make sure that you're checking all these different factors against. So now, smoking. I have individuals who say, yes, I smoke, but I go outside. I go outside and smoke. It's outside. How many have ever seen, and I'll ask this question, how many have ever dated somebody who's a smoker, but they smoked outside and they came back inside and you can just smell them? You're like, my goodness. And you actually start coughing too. You're like, oh my gosh. Well, uniquely enough, women who smoke will have nicotine in their breast milk. But again, one of the things we're also looking at is, in the past, it has been reported that nicotine in breast milk caused infants to have more respiratory ailments. But however, again, that's the reason why we do studies. That's why studies are always done, to try to make sure that it's not so much a correlational study. They want to make sure that it's not a cause and effect or anything else. They want to make sure it's clear. Because correlation does not equal what? Anybody? Causation? But again, one of the things I'm always looking at is, even when the child's around, again, we also have secondhand smoke. Individuals still develop cancer even in secondhand smoke. So that's one of the things I'm always looking at and saying, all right, if that's the case, just make sure you're safe around the child and make sure that you've gone to a different avenue, maybe utilizing nicotine patches. But again, one of the big things is, even today, what do we use a lot of now? They're almost like little devices that suddenly catch on fire in your pocket. Yeah, the vaping, the e-cigarettes, right? We're like, oh, these are safer, these are awesome. And now a lot of doctors are saying they're not safer, they're actually kind of more potent, they're more harmful. We didn't know that until now, because we had nothing to really test them on. But one of the things is, again, you're also looking at the aspect of that. You're looking at how a person, if they're around all these different elements, how are they going to develop? Again, one of the things you're always looking at is, what are the safety parameters there? So immunization. Again, this is where you're looking at, when you look at grandparents and even parents today, we see how things have changed across the board. So within that, immunization is one of the things that kind of came into play in the 1970s. One of the big things, if you look at there, leading cause of death was childhood illnesses. And I was talking to a colleague, and we were talking about that. How many know what Gatorade is? We know what, yeah, we haven't understood. We're like, Gatorade, of course we know what Gatorade is. Well, uniquely enough, they didn't have that back then. I think Gatorade is somewhat new. But all of us have probably grown up with it. But it's one of those things where, what does Gatorade offer? What does Gatorade offer? What is it? What's that? Electrolytes, right? Yeah. So say, for example, you have a small kid suddenly dehydrated and everything else, and you're like, what's going on? He's vomiting, he's doing all these things, his eyes are suddenly dilated. What is going on with this child? A lot of times you're like, well, is it his electrolytes? I mean, he's been running outside all day, and he hasn't drinking any water. I don't know. You give him that, kind of recategorizes everything in their body to allow them to say, okay, because again, is electrolytes important in our body? Yeah.
Yes.
Oh, very, right? But uniquely enough, and I know I'm going on another subject, a whole other subject of food, but one of the things is...
Gatorade.
Yes.
Gatorade cures diarrhea too.
Exactly, that's what I was going to get to. For babies, for kids, Believe it or not, they had no idea what to do when kids were having levels of diarrhea and there were no adverse symptoms. So again, they would give them, they didn't have Gatorade back then. So they're giving them another supplement. But now that we have Gatorade, we're able to say, okay, here you go. Problem solved. Baby back to normal. So now, one of the big things is we're looking at is polio, measles, whooping cough, even chicken pox, again, are no longer a huge impact now. Because how many have ever gotten their measles shots? You usually get them when you're a kid. Yeah. And then you have chicken pox. Now we actually make sure that all kids get the vaccine. We did it before. Because what happens with chicken pox that later on in life? What develops? I'm trying to think right now. Sores, right? Shingles, yes. Now shingles are one of those sores where it is so painful to the point it's your nerves. Your nerves are inflamed, and I don't know if anybody has ever seen a person with shingles. It is impactful. Because you will literally see an open sore and you will see into it and you're thinking, oh, good night. And they're just in absolute agony and you're thinking, oh, I wish I could do something. But, and again, a person will overcome it, but again, it's one of those things where they have to be put on different medication. So now one reason some parents hesitate to immunize their children is fear that, one, the vaccine might end up leading to some level of brain damage. But again, one of the things, I don't know if you've ever, even now, how do you think immunization or vaccines work? Who knows how it works?
The virus, they put the virus inside the person so that their body becomes familiar with it. So that way when the actual virus comes in contact with them, the body knows how to respond to it.
Exactly. But a lot of individuals think, oh, this is a cure, I won't get sick. No, you are, at times, some individuals still get mildly sick, but it won't be as bad as if you did not, or if you were not inoculated. I think that's one of the big things a lot of individuals don't understand. But within this, vaccination has been so successful that smallpox has been initially eradicated, which is awesome. It's amazing. But now we have new fears. We have coronavirus, which is now popping up. How many even believe that that new coronavirus is like something new? How many believe that the coronavirus right now is like some new thing?
New to maybe humans, to the host, maybe.
So believe it or not, in Arizona, we actually have cases of coronavirus. It's upper respiratory and everything else. The only unique thing about this coronavirus is you get really painful Hershey squirts. You know what Hershey squirts is? Bad diarrhea. It's painful, all these different things, as well as upper respiratory. It's no bueno, it's not good. So now you have immunization for better health. So 1 2 months, diphtheria, pertussis, tetanus, polio, influenza, pneumococcal. 4 months, diphtheria, and you go through the whole thing. And then you have hepatitis B. And then 6 months, diphtheria, pertussis, tetanus, influenza, pneumococcal. Year 1, influenza and pneumococcal. And then you have 15 months. Am I going backwards? No, 15 months. Okay, 15 months, yes. 15 months. So you have measles, mumps, rubella, influenza, varicella. And then you have 18 months, which is hepatitis B, polio, diphtheria, pertussis, and tetanus again. 4 to 6, diphtheria, pertussis, tetanus, polio, measles, mumps, rubella. 11 to 12 years, you have measles, mumps, rubella. 14 to 16 years, diphtheria, tetanus. I think that's all of the immunizations. Yes. Does anybody have any questions about immunizations? No, we kind of just jumped through all of that. So notice how it's all spanned out, though. Again, they want to make sure that all individuals, one of the big things is a lot of schools, they want you to be immunized. Why? Why do you think a lot of schools want their child, and some parents are like, no, I do not want my child to be vaccinated. It's the worst thing ever. and then their child's the one that is literally the carrier of that illness and spreads to the whole children. Because that's one of the things they're always looking at. They're always looking at the prevention aspect. Again, I've met some parents who were like, no, I will not get it. And the school's like, well, your child has to leave, and they are so angry, like, this is discrimination, this is racism, this is blah. All these different things, these are all bad things. But then it's also the outlook of safety for who? The majority. So now, what time is it? All right. 8 o'clock. We're out of here at 9:10, right? How many want a break right now? Because I need a break. I'm gonna give a 5-minute break, stretch. I know it's a lot of, we're gonna, literally, after this, we're gonna go through a whole bunch of other stuff and. Does anybody have any questions? So I did stop by Chinle campus. I know how it looks now. And I want to go out to Crown Point, and I want to go out to Tuba City, and I want to stop at, is Shiprock there? Shiprock, right here? Who's Shiprock? Raise your hand if you're Shiprock. Okay, Shiprock.